The story of STIs.
What are sexually transmitted illnesses?
An infection caused by bacteria, viruses, fungi, which can be transmitted through sexual intercourse or close body contact with another person who is infected with an STI.
How do they spread?
For infections to occur, HIV has to pass from the semen, blood, vaginal, or breast milk of one person to the bodily fluid of another person. Small amounts of HIV has been found in the saliva, tears, perspiration, urine, and feces. Casual contact with another person does not pass HIV, but sexual contact or blood contact does. During sex, infected males pass the virus to their partners when ejaculating semen into the vagina, anus, or throat.
How can you avoid getting STIs?
By having safe sex, being or using protection, and having abstinence. Remember, say chlamydia.
What is chlamydia? Is it curable? How is it treated? What will happen if you don't see a doctor?
Chlamydia is a common sexually transmitted disease caused by a bacteria. Chlamydia can affect both men and women and can cause serious permanent damage to a woman's reproductive organs. Chlamydia can be easily treated and cured with antibiotics. HIV-positive persons with chlamydia should receive the same treatment as those who are HIV-negative. Left untreated, chlamydia can lead to many complications. Example for women: inflammation of the cervix, inflammation of the urethra, inflammation of the glands, of the opening of the vagina, pelvic infections, and many more.
This is a picture of chlamydia in the eye. What are genital warts? Is it curable? How is it treated? And what happens if you don't see a doctor?
Genital warts are flesh-colored or gray growths found in the genital area and region in both men and women. Genital warts are sometimes referred to as they represent the most common sexually transmitted disease caused by a virus. The warts are caused by the human papillomavirus. The warts are caused by HPV. Infection with genital warts may not be obvious. There is no single effective cure for removal of genital warts. A number of treatment options exist. However, no treatment is 100% effective in eliminating or preventing them from coming back. Genital warts may go away on their own. About 10% to 20% of people over a period of 3 to 4 months. Examples of treatments are laser treatment and
chemotherapy and Sometimes, if left untreated, genital warts may grow bigger and multiply. Often they go away on their own without treatment, but this act can still spread to other people.
herpes.
What is genital herpes? Is it curable? How is it treated? What will happen if you don't see a doctor?
Another example of STIs is genital herpes. Genital herpes is a sexually transmitted disease caused by the herpes simplex virus type HSV-1 or type 2 HSV-2. There is no treatment that can cure herpes. Antiviral medications can, however, prevent or shorten outbreaks during the period of time the person takes the medication. Also, daily suppressive therapy for herpes can reduce the likelihood of transmission to partners. Someone with untreated herpes can have increased outbreaks. During outbreaks, you can have a higher risk of spreading the disease to others. You are also at an increased risk for contracting HIV. Another example of STI is vaginitis.
What is vaginitis? Is it curable? How is it treated? What will happen if you don't see a doctor?
Vaginitis means inflammation of the vagina. In most cases, it is due to a fungi infection. The patient typically has a discharge, itching, burning, and possibly pain, frequently linked to an irritation or infection of the vulva. Vaginitis is a very common condition. The type of treatment recommended depends on the cause of the infection and may include typical or oral antibiotics. anti-fungis or antibacterial creams, example, cortisone, estrogen cream, and many more. If left untreated, If left untreated, BV may result in increased risk of pelvic inflammatory disease, PID, preterm birth, premature rupture of membranes, low birth weight.
Low birth weight, increased infections, and risk of transmitted diseases.
Last but not least, in conclusion, no STIs.
To be STI free, you have to make sure that you wear a condom and have safe sex.